The tank room is the cryopreservation room where the aluminium cassette will be stored at minus 196 degrees Celsius until needed.
When the bloods arrive in the cryopreservation room, the first step will be that the bloods are placed inside the controlled rate freezer. This is an important step because we want to be very gentle with the cells as we freeze them down, again to protect the integrity and the viability of those cells. Once they are finished inside the controlled rate freezer at minus 90 degrees, they will be ready to transfer into deep temperature storage. The deep temperature storage is at minus 196 degrees, so we do need to wear protective gloves in order to handle these cells now. The different cassettes are added into different racks within the tank, and when they're in these different racks, this is how the cassettes will be positioned in the individual racks inside the tank. These racks are now sitting at minus 196 degrees. Once the samples are placed inside the tanks for long-term storage, they're left there until the day that they're required for a transplantation.
In this room, the viability of the stem cells are assessed, determining whether they are alive or dead. This is clearly visible, as can be seen on the screen.
So one of the most important steps when doing stem cell storage is to assess the viability of the stem cells. The viability is whether the stem cells are alive or dead. So when we're doing a transplantation or we're growing different tissue types from these stem cells, it's fairly self-explanatory that we need living cells to be able to perform this. So the way that this would be done is we would take very micro-sliced sections of a baby's umbilical cord, and we would mix it with a specific chemical, a fluorescent dye. So what we can show you here on the screen is when we have a tissue that has got no living cells in that tissue, the screen will look like this, and it has no structure in it. It's just a plain screen. As an alternative, Christine, will you show us? When we have a tissue with living cells, we can very, very clearly see the intricate network or matrix of mesenchymal stem cells within that tissue. And when we want to grow different tissue types, like nerve or bone or skin or whatever it might be, we need a healthy, living matrix of mesenchymal stem cells like this.
Doctor, what are the advantages and disadvantages of stem cell storage?
Well, the advantage would be that the family, the child, the stem cells would be preserved, frozen, cryopreserved in the stem cell bank, and they would then be available should the child or a brother or sister of the child develop a medical condition which can be treated by transplant. The cord blood that is collected is taken after the cord has been clamped and the baby is separated from the mother, so it is an easy and a safe procedure.
So with science and technology changing, you mentioned that women who are pregnant now can go and have their umbilical cord blood and cord blood taken and stem cells harvested from that. But what about us who don't have that luxury anymore? What are our options regarding stem cell storage?
Again, there are various sources of stem cells which are used in transplantation. The most established form of stem cell transplant would be stem cells derived from peripheral blood, and more conventionally from the bone marrow. And sourcing a match through the South African Bone Marrow Registry or through international registries takes time, is costly, and a match might not always be found.
Doctor, harvesting the baby's stem cells from their umbilical cord, would it only benefit them or anybody else in their family?
Well, the benefit could be to the baby itself as it grows up, particularly if it developed a condition such as bone marrow failure. Often more than 60% of the cord blood collections that take place are used to treat siblings, to treat brothers or sisters who develop a blood disorder or other medical condition which can be treated using the stem cells.
Louis now has to get ready by putting on his protective clothing before entering the clean room where the tissue processing will take place. A clean room is a controlled environment in which the concentration of airborne particles is controlled to specific limits.
So once the cord tissues arrive inside the clean rooms, the first step would be that they get extracted from the collection tubes, and they're going to go through a cleaning and a sterilizing process as we can prepare the sections of the cord tissue that we want to cryopreserve.
The tissue is extracted from the collection tube before it goes through a cleaning and sterilizing process.
The first step would be that we trim the ends of the cord tissue off. What's important is that we remove any pieces of the cord tissue that might not be ideal for storage. And you can see that the cord still contains little bits of clotted blood. So this will need to be cleaned out in the process prior to cryopreservation. The tissue needs to be processed in a clean room environment like this. Because we need to take the tissues out and we need to prepare them and manipulate them prior to storage, we need to make sure that the tissues remain sterile. So inside a clean room like this, which is the same level of cleanliness as a normal operating theatre would have, we can conduct this procedure. So what you can see now, what Alicia is doing, is she's taking prepared tissue that has been prepared through a careful and delicate process, and she's now inserting it into the vials that we will be using to do the freezing and the long-term cryogenic storage.
These cord tissue samples will also be stored in the tank room as seen earlier.
So inside this vial now you can see the different slices of tissue that have been cryopreserved. It's inside these tissues that we will do the viability assessment, where we will add a slice of this tissue to our special chemicals, put it underneath the fluorescent microscope, and then through that highly advanced technique establish the viability of the mesenchymal stem cell networks within this umbilical cord tissue. Once the tissues have been prepared in this method, they will go to the cryopreservation room where they're going to be frozen in an initial step down to -90, and then they'll be frozen down to -196 degrees for long-term storage.
Doctor, you've mentioned umbilical cord tissue and cord blood. Why is it so relevant when looking at stem cell storage?
Well, the type of stem cells that are in cord blood give rise to the elements of blood, such as white blood cells, red cells, and the cells that produce blood platelets. And cord blood stem cells are then generally used for conditions, for blood or hematological medical conditions. Whereas the stem cells that are found in the umbilical cord tissue contain a different type of stem cell. They give rise to tissues such as muscle and bone and cartilage.
Doctor, has there been any stem cell transplants in South Africa to date?
Well, stem cell transplants are routinely undertaken in South Africa, predominantly for blood disorders such as leukemia. In South Africa, 24 umbilical cord blood stem cells have taken place to date. These have been, the vast majority of these too have been derived, they are allogeneic, in other words, they have been derived from cord blood banks from abroad and transplanted to patients in this country.
Doctor, what could be done to create greater awareness about stem cell storage and stem cell storage facilities?
Well, parents, mothers who are pregnant should really take the trouble to find out about what stem cell collection and storage entails. There is a wealth of information that they could get through their own doctors, through their gynecologists, through the midwives, and of course through the antenatal clinics, as well as of course on social media. They can speak to their friends and family who have stored stem cells.
Doctor, the umbilical cord is considered a waste product once woman is given birth. However, you are utilizing that medical waste product for a positive outcome and a benefit, as you phrased it, as an insurance policy. Are there any barriers you found facing people with changing their mindsets to realize that this is actually a good thing to get done?
Collecting and storing stem cells is relatively expensive. So families need to prioritize. They need to be in a secure financial position to afford, to be able to store stem cells for their children.
What is your final pearl of wisdom to the families out there when it comes to stem cell storage?
I think families, parents must find out, they must familiarize themselves with the option of collecting and storing stem cells so that they can make an informed decision.
So from the time the baby is born to the arrival and the processing in the lab is roughly 24 to 48 hours. Once the tissues have been processed and stored, they'll remain in storage for the next 20 years at least, awaiting that potential transplant. So thank you for joining us on the tour today. We wish you all the best.